The AMSA, or anterior middle superior alveolar nerve block, will achieve pulpal anesthesia from the central incisor to the second premolar on the site of injection. A bilateral AMSA will achieve pulpal anesthesia from the second premolar to the opposite second premolar from just 2 injection sites. This injection is ideally suited for restorative dentistry, scaling and root planing, and other soft tissue procedures involving the palate. The benefits include the ability to achieve multiple tooth anesthesia from a single site injection, the ability to get pulpal anesthesia without facial numbness. You can reduce the dosage required for the anesthetic effect, and it's a very comfortable injection for the patient to receive. Recommended dosage is from 3/4 to 1 full cartridge, which will require 3 minutes or more to deliver, achieving a duration of from 60 to 90 minutes. Use a 30-gauge half-inch needle. Set up the wand as usual. The landmark for this injection is at a point which bisects the premolars and is midway between the free gingival margin and mid-palatine suture. The site is the same on the opposite side. The landmark for the AMSA will vary somewhat depending upon the anatomy of the palatal vault. A more appropriate description may be between the premolars and at the junction of the horizontal and vertical component of the palate. The injection should not be approached perpendicular to the palate, but rather at a 45-degree angle with the palatal tissue to ensure the bevel is parallel with the palate. Initiate the pre-puncture technique by gently placing the bevel against the palatal tissue, but do not puncture the tissue at this time. Apply pressure on the back of the bevel with a sterile Q-tip swab to maintain a seal. Now activate the slow flow rate for approximately 8 to 10 seconds. Listen for the cruise control sound tone at this time. Activating the cruise control function will lock in the slow flow rate for this injection. Continue the slow flow rate and penetrate the surface of the palate very slowly and very gently with a slight rotation. It should take several seconds to reach bone, depending upon the tissue thickness. Once bone is reached, perform an aspiration and maintain contact with the bone, aiming the bevel parallel to the osseous surface. Maintain pressure of the bevel against the bone. Listen for the cruise control sound and reactivate cruise control. Deliver 3/4 to 1 cartridge of anesthetic at the slow flow rate. Once the dosage is delivered, remove the needle and look for blanching.